Greetings, a warm welcome to another Saskia Unreserved. Look who I have in the studio with me today, Dr. Memnia Theodorou.
Hello.
Dentist, I don't know how to describe you, adventurer, academic, also has just completed another degree in positive psychology, so we're going to be discussing that as well. She's been here on the program before, so it's wonderful for me to see her once again and to discuss this duality of professions. One doesn't only have to encompass one profession, you can actually do two, and this is what Memnia has done so carefully, so skillfully, with so much panache with her new clinic, and so that's what we're going to be talking about today. If you'd like to ask any questions, any advice, anything at all, please feel free, and we'll address the questions to Dr. Theodorou. Thank you. And we've just heard the Chanson Symphony in B minor, and that's brought us just after 25 minutes to 1. And a reminder for those who have just tuned in, this is Saskia Unreserved, coming to you live from Nicosia. We are also on Facebook streaming with my very special guest in the studio here with me, Dr. Memnia Theodorou, and we are going to be discussing the duality of professions. Memnia, very warm welcome. Nice to see you again.
Nice to see you again. Thank you very much for the invitation, for having me here. Really lovely.
And we really know you as a dentist. I particularly know you more as an adventurer.
Yes.
Very inspiring, showing that really one can do anything one really puts one's mind to. And you've just completed now an MSc in Applied Positive Psychology and Coaching. You've brilliantly matched it with your dentistry practice. So I wanted to ask, why start another degree?
How long do we have? It's a long story. So my first profession is dentistry. Then I practiced dentistry for quite some time, for many years. I was in London, in England, and life difficulties found me, like they do in life.
Yes.
So mine were profound and traumatic at that point. The loss of a loved one, my sister, and other things that were happening in my life as well. Also a toxic environment at work. So it all happened at once. And it was a quite challenging and difficult period of my life. And after the first period of time that you just try to survive, really, after all of these things happen to you, I was trying to find a way out to feel better, because obviously I felt depressed and a very low point.
Yes.
And so I tried a lot of things that didn't seem to work, like going out and traveling and therapy and all these things, and they didn't seem to work. And so this is when I turned to adventure, because you mentioned adventure. So this is why I turned to adventure. But it wasn't the reason, but it was just another escape. It was, I thought, let's give this a go. See what happens. Yes. Nothing else has worked. And I found that sports and the adventurous spirit and the competitiveness of a race, the sailing race that I took part in, it was enough to take my mind off what was happening in my life, and to find out that I can become a better version of myself, even a better version compared to the one that I was before the challenges that found me, before the depressed stage. I found my new strengths. I built better connections with the teammates. I found out what I could do, that I could achieve a lot more in life than I ever thought possible.
Yes.
So for those who don't know, I sailed from the UK to Australia. I'm the first seafarer to have done that. So when you do something big like this, you come back with a renowned sense of confidence and self-belief, but also believe in others, because I saw other people, I saw older women, 70 plus, sail alongside me.
Yes.
So,
and it's a tough race.
It's a very tough race, and
physically and mentally.
Yes, and psychologically, like, you're exposed to practical risks and dangers. Your life is at risk at some times. but also you live in a confined space with other people on a boat for months, so that's a challenge on its own,
I'd say.
And then the sailing part is also a challenge on its own, and when you come across those big waves and the freezing temperatures near Antarctica, it is so difficult that it takes your mind off of anything else. And that's why it helped me refocus on something else, on something practical, on something physical, on the team. And because of that, when I finished the race, I felt like a new person. I didn't find my good old self. I built a newer, a better self.
Right.
And I saw others build themselves up through this race. I watched others do that. Like when you have a 74-year-old lady with you competing, and of course we couldn't all do the same things, and that's fine, but everyone contributed what they could.
Yes.
And so I came back with this renowned faith in humanity and how much people can achieve. And I wanted to be that lighthouse, that beacon for others, that others had been for me. And this is how it started. It started little by little, this conversion of professions, let's say, or an addition of professions. So it started first as motivational speaking. So I went to schools and organizations and companies, and I was sharing this story purely because I wanted to inspire others to believe in themselves.
Yes.
And then after that, workshops started. So I would prepare like little exercises, and I would start giving workshops and help groups of people realize their own things through my experience and through some exercises. But then the issue that was becoming obvious is that people wanted more from me. They would then approach me after the talks or after the workshops, and then they would say, okay, can you help me?
Yes.
To change my life. I don't want to go really on a sailing boat. I don't want to put my life at risk. So can you help me? And the answer was no, because I didn't have the skills. I wasn't a psychologist, a therapist. I was a dentist who had an amazing experience.
Yes.
And my story was enough to inspire, but I didn't have the tools to help others. And that's when the addition of the Masters of Positive Psychology came along, because I thought, right, if I'm serious about this, and if I want to help people, and if I want this to be a profession, then I need to equip myself a bit better.
Yes.
I need to do some sort of degree. It doesn't have to be an academic degree. I thought about this a lot. In any case, I ended up finding this degree in London, the University of East London.
It's the only one.
It's the only one that combines positive psychology and coaching psychology. So they're kind of different disciplines,
yes,
but they combine very well together.
Yes. How is that different from clinical psychology?
So clinical psychology, well, psychology, first of all, has many different branches.
Yes.
And clinical psychology, like the name implies, has to do with disease, mental disease.
Yes.
It has to do with diagnosing mental illness and treating mental illness. So that's the clinical aspect of psychology.
Yes.
Deals with distress, with disorders, with illnesses. It deals with that sort of stuff, with trauma. Positive psychology is a different branch, and it doesn't deal with any therapeutic aspects. It doesn't deal with diagnosing anyone with illness, and it doesn't deal with treating them. We deal with people who are usually functioning well in their lives. They're stable emotionally. They're just missing something. They've lost their way a little bit. They lack this sort of inspiration in their life. They lost their purpose and meaning, and they want something more. They know that this is not just it. So they don't have a mental illness, or they haven't just gone through a traumatic experience and then need support. There are everyday people like you and me who need that sort of oomph in their lives. They know there is more out there for them, but they don't know how to find it.
Right.
So that's the difference.
What does the degree actually encompass? We hear the word positive, and one immediately sort of has quite a lot of connotations that you have to go around with a smiling face and be happy, and nothing else matters, everything is positive. I mean, life isn't really like that.
Yes, exactly. This is a lot of people make those assumptions, and actually they're not correct. And positive psychology has come under fire because of this, because people do tend to associate that with just positive thinking, which we know that is not it's not how life works, and it's not how things work. So Positive psychology just means finding out what makes people happy, what makes people thrive and flourish. So it's not about always thinking positively.
Right.
It's about recognizing all your emotions, but enhancing more the positive ones, the strengths. Because as human beings, we tend to focus on the negative things. We have a negative bias, don't we?
Yes.
So we tend to focus on what our weaknesses are, for instance, or the things that went wrong in our days, but we don't focus enough on what went right in our day, or our personality strengths, or our character strengths. So it focuses more on what goes well with people and with situations and it builds on that. And actually, positive psychology makes a very strong point that we want all emotions. There are not positive or negative emotions. There are just emotions, and emotions are information, and they give us an information about something. So if you're angry because you're being treated wrongly, why is that negative? It's an appropriate emotion.
Yes.
And it helps you respond accordingly. And if you've lost someone, being sad is not a negative emotion, it's an appropriate emotion.
Yes.
So positive psychology actually encompasses all emotions. It's
Right.
just building more on the strengths we have.
Why do you believe it is that so many people feel lost and dissatisfied with their lives, and they're somehow always striving for more? Do you think that we should maybe be happier with what we have?
I don't know why many people, or if there are many or a few, but some people do struggle finding meaning and purpose. I think the balancing point is it's an art. I think it's kind of like an art. If you strive for better, it gives you direction, and it does make you happier to strive towards becoming better. However, at the same time, it's an art to learn to be happy and content with what you have now,
Yes.
while you're trying to improve yourself. So I think what we learn in positive psychology is to kind of find this balance between these two things. So to have a goal, but to also be appreciative and thankful and grateful for what you have already.
Why do you think it is that it's so difficult for people to move forward?
Move forward in
Whatever they are striving to do. That gives them that challenge.
Well, I mean, comfort comes to mind. Comfort is a big
Right.
thing. Neurobiologically, we do not like change, human beings. We want the path of least resistance. So we are wired to repeat things. And every time moving forward means changing, means doing something different. If you do the same thing, you're not moving forward. So moving forward does take some energy. And our brain doesn't like that. But yes, it's the only way to achieve more in life.
We seem to be in a world surrounded by anxiety and stress. And there are also two words that are really frequently used. They are, however, quite different. Anxiety and stress.
Yes.
Can you begin by defining anxiety?
I think this more goes down to the clinical psychology route, this definition. But
Yes.
anxiety, from the things that I know, can have many levels. So a person can have anxiety, and that means for that person that before an intense event they get nervous and they have palpitations and maybe they have shortness of breath. And another person with anxiety might have a full-blown panic attack.
Yes.
And they cannot function. Maybe they pass out, or they turn white, or they just vomit, some people. So there are different levels of this anxiety, and sometimes it can be a disorder. And if it is a disorder, then it doesn't just need the psychology aspect of it, but also maybe the psychiatric part of
Yes.
it. Maybe it requires medication, but that doesn't mean that a person cannot benefit from combining the approaches. So
I was going to say that's
yes.
a very important factor that you've said, because it's not actually just so clear cut, is it?
No, it's not.
Sometimes things circulate and they make you really anxious on and the more it goes around and around in your
Yes.
head, the more anxious you become, and it's somehow a circle and you can't get out of it.
Yes. Let me give you an example. So I had a lady, and this has happened a few times, and they come to me saying, I have panic attacks, and I have seen a psychiatrist, so I am on medication.
Yes.
And I've seen a therapist, and we've done some work, and I understand where it comes from.
Yes.
But I'm still not able to manage them, and I'm thinking of trying something different. So they come to me as a coach, because I'm also a coach. And
Yes.
a coach is a bit different than positive psychology, but it also focuses on the future. So therapy and clinical psychology focuses more on sort of the past and understanding the past and maybe healing the past.
Yes.
Whereas coaching and positive psychology, they focus more on moving forward. We acknowledge the past, we show respect to what has happened, but let's see how we can move you forward. So it's a different aspect. So they come to me saying, well, I've tried therapy and I've been to psychiatrist and I have medication, but I would still like to grab hold of this thing a bit better and not need the medication. So we try coaching as well, and
Yes.
each part has helped them in a different way, because coaching skills that they learn there help them to deal with the panic attack when it next arrives or when they think it's going to arrive. Therapy deals more with making them understand why this is happening, and sometimes the medication that they are prescribed works as their blanket, their safety blanket. So they know how they have the tablet if they need it, if it's really
Yes.
bad.
Yes.
And they have the therapy, so they understand why this is happening, and then they have some coaching skills to work with in that moment when it's happening. And actually I've seen it work very well. I've worked with at least 3 people who had quite the panic attacks, not just the
They're
usual.
debilitating. They're debilitating.
Yes, they can be, and I've had very good results. It's this combination of approaches, I think, works very well.
How connected is anxiety to fear, and does the one sort of permeate through to the other?
Yes, most definitely. And I think sometimes what I've noticed, their fear of having a panic attack when they least want it is what brings it on. It's not actually that they're anxious about something, but this worry and this fear that it might happen, it triggers it.
Right.
So one feeds into the other.
Does this anxiety, which is really much more difficult to tolerate than fear, does this limit people, and how do you help them to actually move forward?
It definitely can limit them to what they can achieve, because when you have something like this happening to you, then you restrict yourself a little bit, because you're worried to put yourself forward in case this happens, and maybe you ridicule yourself, or maybe you can't cope. So you do restrict yourself a little bit, so
Yes.
you don't reach your full potential. I mean, we most of the times we start with building on their strengths of the people. So this is what positive psychology does in combination with coaching. So when someone has something negative like this happen to them, like an anxiety or a panic attack, then they go into a negative thought loop, and then their thoughts just pound on, and they make this worse in their minds, and maybe they're belittling themselves as well, and they just make it worse, and they generalize, and they think that their whole lives is like this, and that they will never be able to achieve anything. So the first things we try to do is actually to help them remind themselves of times that they have managed to achieve things, times that they have managed to pause or deal well with that panic attack. So it helps them remember that it's not always like this. Yes, sometimes it has happened that I couldn't deal with it, but there are other times, probably more, that I have managed to deal with it.
Right.
And then we help them discover or bring forward what the skills were that they used in the times that they did manage to overcome this. So a big thing with coaching is that it doesn't have an advisory role. I'm not going to tell someone this is what you need to do in a panic attack. I ask them, what has worked for you in the past? You have the skills already, because sometimes you have managed to overcome
Yes,
this. So
yes.
let's break it down. Let's see what works for you. 1, 2, 3, 5 things, whatever it is. Can you do more of that? That's the next task. Can you do more of that? And then we build on their strengths.
It's interesting how you put it, because I think there are quite a lot of connotations attached to psychology, that you're not okay, you're not mentally fit. We all know about the bias of needing mental or psychiatric help, and this is something that actually that affects so many people. They don't want to actually admit it.
It's true, and dare I say, more men than women, because the stigma is more on men. If men seek help,
yes,
I think there is more stigma attached rather than when women seek help. So I think it debilitates more men because also they do not seek help.
Yes. Do you think that saying that, oh, I'm going to see my coach, as opposed to I'm going to go and see my psychologist, who usually just says, well, you know, how are you feeling? How are you? What are you going to do with this? You know, somebody really who's gone for help wants somebody to affirm or disaffirm what they're thinking and feeling.
I think there is less stigma attached to people saying, I'm going to my coach. But I do have to say that seeing a coach is not for everyone. Depends on the life stage you're at. Like if you really need support and dealing with a traumatic situation, then a coach probably is not the right for you at that stage of your life. It might be later on when you feel a little better, when you've recovered from the shock.
Yes.
But you want to move forward. So a coach might be for you down the line. So it's not for everyone. But yes, I do see that people feel more comfortable saying I'm going to a coach rather than I'm going to my therapist. And I didn't notice it actually at the beginning until a woman pointed it, one of my coachees, she pointed it out to me, and she said, yeah, you know, because it's easier to say I'm going to a coach. And I never thought of that. And then I started noticing it, that it is easier for people. It's less stigma to say I'm seeing a coach.
Why you referred in the beginning of our conversation to people seeing the negative traits in themselves and their flaws. Why do you think it is that we do that and we focus on our character flaws rather than on our strengths? I mean, not many people, I may be wrong, but get up in the morning and think, wow, I look great. You know, they'll say,
wouldn't it be lovely we did that?
Yes, I mean, they'll say, oh, I wish my hair wasn't like this, or oh, you know, I wish my belt was one notch, tighter.
I think fundamentally it's a protective mechanism, and maybe an evolutionary one as well. Like, go back to the bear time and cage times. Like if you focused on what a lovely day it was, and your focus was on the positive side of things, then you might not have noticed the lion approaching you. So evolutionary, it worked better for us if we focused on the negative things.
Right.
Because if we focus on the negatives, we have higher chances for survival back in the day. So it's more like a protective mechanism. But nowadays we don't have bears and lions walking around, and it does protect us in a sense, but I think it does more detriment than it does good nowadays. So we do have a negative bias as human beings, and we have cognitive distortions, they're called as well. So we focus on the negative aspect of things, and each one of us does that in a different way. So some people might take a single negative event and then say that it's my whole life. I'm always unlucky. Like, you know, an unlucky thing happens and then I'm always unlucky. Or some people
magnified in such a way.
And some people always internalize whatever happens and they blame themselves.
Yeah, or I don't know, you lost something in the house and you say, oh, I've lost everything.
Yes. So it's each one of us has a different variation of these cognitive distortions, and they become loops because you have this thought, and then this thought causes you this feeling like you feel incompetent and you feel frustrated with yourself, and because you feel frustrated, incompetent, or whatever you feel about yourself, then this affects how you act or how you react and the things you do next. Because you feel that you're worthless or whatever it is you're feeling, then your actions kind of mirror that, and then it comes back and reaffirms the first thought that you were incompetent. So it's a loop. And with coaching and positive psychology, we do learn, it takes some time,
Yes.
but we do learn how to break these cycles and replace some of this thinking with more adaptive and more serving
Yes.
way of thinking to
Yes.
you.
Do you think that these situations also stem back from people's childhood and any sort of conditional upbringing?
Definitely, most definitely. But as I said, with with coaching and positive psychology, we try not to dwell too much on that.
Yes.
We do take information from the past. It's not that we deny the past, but we take it as information. So instead of trying to understand why our parents treated us this way, or why this dynamic happened in the family, we accept
That would be a clinical.
Yes, more like therapeutic aspect.
Yes.
If you still need to understand why it happened to you, or why am I like this, then it's more on the therapeutic path.
Yeah.
When you're kind of like fed up, well, this happened and I don't want to analyze it anymore, I just want to find a way to move forward, then that's when coaching and positive psychology comes in.
What happens if you leave out that step of the therapeutic? Is that important for your patients to have actually been there and done that before they come to you? What happens if you see them like that? Do you send them back and say, I can't help you at this stage, you need to get through stage 1 before you get to 10?
Before we start any sort of sessions with anyone, personally, before I start, I do have a chat with them and I ask them what it is they want help with, what is that brings them here, and what it is they want to achieve through the sessions. So I have a good chat with them, and then I see what is the issue that brings them there. And from that chat, I can understand if it's on the therapeutic path or if it's more in the moving forward and coaching path. So I can understand it at that point. And if I cannot help them, I do say, I don't think that coaching is for you, perhaps it's a different route. So I do refer them, and I do recommend other people therapists that they can see.
You have other psychologists with whom you work?
Yes, that I trust and I work with, and I can refer these people to them. And you have to be a little bit careful how you say this, because you don't want people to feel that you see a problem with them.
Yes.
But you can be clear that coaching is not for this. You can tell them. And personally, I think that our parts that need healing should be healed. However, sometimes this is an ongoing process, and sometimes they are parallel processes. So maybe you have a traumatic event, and maybe you've done some therapy in the past, but now you want to progress your career a little bit and just leave that aside for a bit. So it's fine to see a coach and progress your career. And then maybe at a later stage of life, then maybe you want to go back and do some more therapy and back and forth. So I don't think it's clear cut. First you do this and then you do that. It also depends on what the issue you want to deal with this and the stage of your life. Yes.
Moving to communication, Dale Carnegie in his book How to Win Friends and Influence People hints at the strategy of trying to understand people and figure out what they do rather than condemning them. Do you believe that our communication skills are generally poor?
Yes.
Or inadequate?
Yes. You mean here in Cyprus or as human beings?
Probably both. Let's start with human beings and put it down to Cyprus.
I think, especially in the educational system here, but also in our upbringing, we haven't learned a lot, I would say, to communicate and to listen. This is not just in Cyprus.
No, they're two different things.
Yes,
actually,
two different things. And I think I should have said listen and then communicate, because very often we do not listen to understand the other person. While the other person is talking, very often we're thinking of what we're going to reply back, or we're thinking when this has happened to us and we just want to say, oh, this has happened to me. So we're not actually listening to what that person is saying. We're not trying to understand or sympathize or ask more questions and be curious, genuinely curious about what happened to that person. Usually we're thinking about how we're going to respond to that.
There's a lack of empathy.
Yes. And we do not have good listening skills, I would say that. I don't mean just in Cyprus. As human beings, perhaps more in Cyprus.
There's a large tendency to interrupt.
Yes. That's a cultural thing as well, I think.
Isn't that something that's supposed to be taught, I don't know, when you're about 2 years old? Don't interrupt. I think I heard that many times until I was 5.
But these are skills that you also pick up later in life. Like when I first went into the coaching degree at the university, we had quite a few exercises on how to listen, which sounds so trivial maybe on the surface, like you just sit there and listen. But no, we had to listen, and then we had to summarize what the other person said, so we had to listen attentively.
Active listening.
Yes.
Yes.
And then we had to try to listen while other people were trying to disrupt us or make noises, like just be
disruptive.
Disruptive. So we had to learn actually how one listens properly, and usually it's not with our ears. We listen actively with our eyes. So it's a skill you can learn, and I mean, organizations have communication programs, and not all organizations, but it's nice for organizations when they organize these workshops, because it's a skill you can learn, and it does help.
Very important, because correct me if I'm wrong, it leads to a lot of misunderstandings because someone's talking rather than listening.
Yes, it can lead to a lot of misunderstandings and a lot of anger, and
Do we conduct sufficient perspective taking? This sort of cognitive attempt to consider another person's viewpoint?
I may be biased because I work with people who are open to do that. So people who approach me for coaching or workshops, they are people who are open to do that. They want to understand themselves, and they want to understand others, and they want to have better relationships. So I primarily work with people who are open to taking that perspective.
Self-awareness really requires one to separate a sense of identity from thoughts and emotions. How possible is this, and why is it important?
I think it's a lifelong process. It comes easier to some people than others.
Yes.
And some people have an inclination to want to understand themselves, and others just want to block everything away and they do not want to deal with it, and that's a separate problem. But being self-aware helps you manage yourself better. Understanding the parts of yourself, understanding how you usually react, understanding why you react like this. Being self-aware does help you then become an observer of yourself and others. So you become more of an observer of your thoughts or your emotions while you're in action, while it's happening. It does take quite a bit of time. It doesn't happen, from one day to the other. It needs a bit of work, but the first stages of being self-aware is actually to break down what it is that is happening when this situation happens. So then you become more aware of yourself. What is the pattern? What's the repetition here? And then you can break it down more to, so let's see what are the steps and what are the thoughts that trigger this. And then while it's happening, the next time it happens, you can become an observer of yourself dealing with this. And you might not be able to break that cycle at first, but becoming an observer helps you with every time that happens to be, for the first time you might be, this cycle just happened and I didn't manage to break it. But then the second time you'll be like, it's happening right now. I still cannot break the cycle, but I can see it happening. And then the third time, while you're halfway through this motion, you'll be like, no, I can see it happening now, and then I can break it. So that's how self-awareness works. So little by little you can break your patterns.
Do you think we've lost our ability as humans to be empathetic? I look at social media, I see, all the vitriol, and I'm wondering if we're really, as a human species, we're not really very nice anymore.
Well, social media does bring out the worst of us, I can say, in some occasions, because we are hiding behind a keyboard, and there is anonymity, and there is some kind of protection. It's not like you're saying something mean to someone's face and then they can be you.
Is that more difficult?
What?
To say something nasty to someone's face?
Yes, definitely. there is also the fear aspect. Like if someone is much bigger than you, probably you wouldn't be so arrogant in saying something mean towards that person, but behind a keyboard you don't care. So that's one aspect. But the other thing that I will say is that, you know, social media, they're just bubbles. So the more you look at something, the more Facebook or Instagram will feed you this thing again, because it triggers you and it draws you there. So I've made a conscious effort, first of all, to have a variety of topics in my Facebook, for instance. So I don't only click on this. I click on the opposite opinions than mine as well, because I want to have a variety of opinions coming in my newsfeed, because you know how Facebook just kind of
the
censors.
algorithms are
I don't know, it's they're very odd. So I make an effort to have different opinions coming in my newsfeed. And then I also make an effort to bring positive news in my newsfeed as well. Otherwise, you can just get into that negativity loop, and Facebook will just keep showing you that, and then you will think the whole world is like that. Whereas it's not. So I have a lot of, you know, think of how many charitable organizations there are out there. Think about all the volunteers that help others. Think about all the people that have moved themselves to organize food and blankets for, you know, the war or whatever. So there is a lot of good in the world as well, but when we only click on the negative news, then that's all we're reproducing.
Do you have clients who come to you who are resistant, or are they
changing?
In to change and to engaging, or do they mostly come to you because they really want to change?
You know, one of the first things that you learn at university is to assess in your head if someone is what we call coachable. What does that mean? It means
probably that was the word that I wanted to find.
Are they coachable? And that means, are they ready for change? If the answer is no, it doesn't matter if you're the world's best coach or best therapist or best psychiatrist or best of anything or best educator. It does not matter. If that door is shut in their mind, you cannot get in. So the first thing to assess is if someone is coachable. And there are different degrees of that. You know, someone might be completely closed, like they're right, and there is nothing you can say that can change their mind. So they're completely blocked off. So do not even try. And there are other people who have seen that something is not working in their lives, but they're not quite ready to accept it. So you can gently ask them some questions to start opening up. And then there are others that are on the other extreme, that they blame themselves for everything. And then you have to bring that back a little bit and say, right, maybe you've done some mistakes here, but you're not the only one to blame. So you have to assess how coachable we say someone is. And is actually, we had this discussion with my partner, and he was saying to me, oh, you know what the great thing would be, like if you could convince, he would use this word, people who don't really want to change to improve their lives. And I was like, if someone does not want to change their lives, if they see nothing wrong with their behavior, if they don't see any way of improving, I'm not going to go in there and convince them they could be doing things better. If everything works and they're happy with where they are, let them carry on. When they want something more out of their life, when they come to the realization like I could be doing better, I'll be there for them, but I'm not there to convince them. So most people who come in are open to change, so they don't have that much resistance. And I can assess that as well when we first chat. But you might find some resistance down the line when you approach a topic, and maybe it's a triggering topic for them, and you might find some resistance there. But usually they're open to you, and usually they know you. When I say know you, they know you from social media, so they would have seen me do lives or explain a topic, or they would have heard me talk somewhere. So they already know what I stand for, and that I want to help them. So they come open to me, usually.
Can positive psychology be negative in any way? Dr. Hugo Alberts, a former professor of psychology in the Netherlands, alludes to this with regard to negativity. And he said it's important. It's an important part of life. I think you alluded to it earlier when you said, you know, if somebody is sad and something has happened to them, I don't know, they've got divorced, they've lost a child, you know, they've had a death of a parent, then it's quite normal to be sad. And then one shouldn't say, well, you know, the world, it could be worse. Something else has happened, you know, and magnify it.
There is a term called toxic positivity. This is not only from positive psychology. I mean, it's within the world of psychology. It's called toxic positivity, and it's exactly what you're describing. Forcing someone to see things in a positive light when they've just lost someone. Or blocking them from expressing their feelings because you think, or you don't want to hear them, or you think they should be moving forward faster.
Yes.
Or because you want to make them happier, and just, this is toxic positivity. Yes, so there can be a spin of negativity, let's say, in this whole positive aspect, and we do that often as well. Like when we are not ready to be with someone who is sad, just be with them. When we are not ready to hold their hand and just listen to them and say, I understand, it's very difficult, and say nothing else. Like if someone has lost someone, there isn't anything you can say to make it better. You are not going to make it better. All you need to do is just sit with that person while they go through it. And you don't need to force them to feel better. You don't need to try to make it better for them.
Right.
They just need a holding hand. That's it. And while they're going through this.
Can positive psychology lead to avoidance?
I don't know if positive psychology leads to that, but in trying to make yourself better, you can avoid things. And actually, I've studied post-traumatic growth, which is the opposite of post-traumatic stress. So anyway, kind of like a parenthesis.
Yes.
And avoidance can be part of the healing process, so long as it's not forever. So if you've gone through a very traumatic event, sometimes not thinking about it for a bit can act as a protective mechanism and a mechanism to help you move forward. So long as down the line you do come back and revisit these things. Like if you always avoid it, then it's not healthy behavior. If you never want to talk about it, it's not really healthy mentally. But if you've been through a very traumatic event and you want to avoid it for a bit, it can help you build yourself up. And actually this is what happened to me when I was in the sailing race, because I was all the time thinking about the negative things that happened to me, and I couldn't get out of that loop. And then I went and did something completely different, and for a few months I did not think about it on a constant basis. Like every so often I would think the loss of my sister, but I wouldn't constantly be thinking about it. My focus was on something else.
It didn't sort of pervade everything.
Yes, it didn't. And because my focus was on something else, it allowed my subconscious to do the work. And then when I came out the other end, I could revisit these emotions without the intensity of them. I could see them for what they were.
That's so important, that word, intensity.
I was not lost in the grief after that. I could just see it and accept it. And accept that I would be having bad days down the line. And when the bad days would come, I wouldn't fight them. And I would say, this is a bad day, but tomorrow is going to be a better day.
Right.
So just sit with it for today. It's fine. It's a bad day. Tomorrow is going to be better.
Memnia, you've now got this hat. You've got your dentistry hat. How, because I know how you've put the things together, but tell our listeners and our viewers on Facebook, how have you managed to marry the two? It was quite a work in progress. The building, the changes. All that you did on your own.
I know. Well, on my own, I did have help from the builders and the architect and the business consultant and everyone. So
But the genesis was yours.
Yes. So I was still working as a dentist in England, and I was practicing my coaching and my speaking alongside that. And then I thought, well, an opportunity came along, and I thought, okay, I want to take advantage of it, and I want to see where it leads me. And I wanted to build a dental practice. But when I started this dream, I was mostly a dentist with a little bit of speaking. And then as I was building this dental practice that I've built now in Larnaca, it's called Positive Smiles.
Yes. I love that name.
Yes,
I loved
it's
it.
a combination of smiles dentistry and
Yes.
positive psychology.
Perfect.
Yes, and I did ask my audience and the people who follow me to give me ideas of names, and this was the best one that stood out for me: Positive Smiles.
Yes.
So as I was building this, which is a process that did take, I think, 3 years from the inception of it, and then putting a business plan together, and then applying for funds and a loan and whatever, what have you. And then COVID hit right in the middle of doing this, so it delayed like the orders and everything. And for a bit, everything shut at the beginning. So it was a long process. But in any case, as I was building this practice, my vision changed a little bit. And I thought, I do not want this to be just a dental practice. I want this to be a center for wellness, mental, emotional, physical. So I had extra rooms.
Yes.
And so in there is the dental office, obviously. And I also have a nutritionist and a clinical dietitian.
Right.
So that she deals with the body aspect and helping you have healthy nutrition. Her name is Andrea Mariu.
Yes.
And then I also have Joanna Hilmi, who is a massage therapist, and she does holistic massage. So she deals with the aspect of relaxation and all that, and a connection of mind, body, and spirit.
Yes.
And then I also do the coaching from there, and I do that online.
Yes.
Primarily nowadays. I mean, initially the thought was that it would be my office that people visited to have coaching sessions there. So this was the thought. But as I said, halfway through the building, COVID hit, then everything went online. And actually I found out that it does work just as well online.
It's very convenient.
And it's quite convenient, and it's more flexible to do that online. But I do run the coaching sessions from there as well. And I run webinars and workshops online from there as well. So I have a friend, she's a coach, and she said, this is going to be like a case study. I don't know anyone who has done like a dental practice and a coaching practice. She's a coach, and so she says, you'll be a case study. We'll have to see how it goes.
Yes.
I don't know. We'll have to see how it goes.
Yeah, I think the whole concept is wonderful, and I like the idea of wellness because you smile and your teeth are the first thing that we see.
Yes, exactly. And we can smile, make your smile beautiful, like the looks of it, but also to bring you more smile with massage and coaching and building on your positive aspects and nutrition. So I think of it more of a center, and it's funny in a way because sometimes we get so attached to that dream that we don't let it like take form.
Yes.
So in this case, I was forced because of COVID.
Yes.
To kind of like loosen up like the plan.
Yes.
And allow it to unfold in different ways.
Flexibility is a good
and adaptability.
Yeah,
it's a very good skill, a leadership skill, I'd say. Yeah.
Memnia, if somebody is listening and they want to be in touch with you, how can they find you?
Well, my personal website that deals with the psychology and the speaking aspect is memniatheodorou.com. So that's the website if you want to find me for your personal coaching, or invite me to your company to speak. And the wellness practice, it's positivepsychology.com.cy. So those are the websites. But obviously I'm on Facebook, Dr. Memnia Theodorou, on Instagram, LinkedIn, Twitter, all the social media. I'm quite active on Instagram and Facebook, and so people can definitely find me there. Yeah.
It's been wonderful to see you again. Thank you so much, and everything of the best for Positive Smiles. As I said, I love the name, and I'm sure you're going to help an awful lot of people.
Thank you. Looking forward to seeing you there.
Thank you. So that is Dr. Memnia Theodorou, The Duality of Professions, our discussion today, and we continue now 25 minutes past 1 on Saskia Unreserved with Wieniawski and the Scherzo Tarantella.
Okay.
Thank you so much for watching.
Bye.